Sorry about that, had to cut for a second. The next thing in this pouch, we got a standard triangle bandage. You pick these up pretty much anywhere. Again, all in the pouch. Standard triangle bandage, pretty much a nice thing to have in any kit if you can fit it. Then we have some Betadine. This is going to be just a liquid form of the Betadine. You can pick these up. A lot of this stuff is like eBay. You can get it for real cheap. These are the, I think, 15 cc little containers. I got 2 of them in here just for some wound care. If you need extra, I have more Betadine in this kit than this, but this is just some extra that I keep in here. Then we have one of these the smaller Israeli bandages. You know, I've never used one of these. They're nice because they're sealed up in a bag. This is the 4-inch. I've opened one up and, you know, played around with it a little bit. They seem pretty good. I really don't have an experience with it, but, you know, I had room in the bag, so why not throw one of these guys in there? We have some more Sting. These are the swab kinds. These aren't very good. I just keep them in there because, you know, why not? I got them. They're extra backups, you know, in case the other ones don't work or they get broken or whatnot. So that's pretty much that pouch. Moving along, there's a lot of this stuff I really won't need to take a lot of it out. I can just pretty much tell you what's in here once I show you one pocket. This one, obviously, there's 2 ace bandages in there. You know, there's a lot of different tapes and stuff that are replacing ace bandages. Ace bandages, still in my opinion, still useful, still good. So I keep 2 of them in here. I have room, so I figure why not. This next pocket here, we're going to have our illumination. We have just a little simple LED ring light here. It's fairly bright for what it is. It's not terrible. But we have our Cyalume sticks here. I keep 3. One is the 8-hour orange, and I have 2 30-minute light sticks in here. The 30 minutes really, they blow away the 8 hours. The 30-minute ones, they last for about 30 minutes of extreme bright. Pretty much as bright as that LB2. But then after about that 30 minutes, you probably get another 4 hours out of them. The normal brightness of a glow stick. So, you know, when you need the light, you need the light. These things really, they're alright, but the 30-minute ones are really where it's at. In this pocket here, I have just a standard variety of needles and syringes, all different sizes. I have all different sizes. I mean, there's insulin syringes in here. There's syringes for administering lidocaine, all prepped and ready to go. You know, all different size needle heads in case you need to, you know, they're good for everything. In case you need to pop a blister, in case you need to, you know, pull out a huge splinter or, you know, do anything. I got different types of syringes and needles in there. You know, you can buy a variety pack of needles on eBay for very cheap. All sterile, of course, and you know, just pack them in there just to have a nice variety of things that you can use. In here I have the breathing kit, which is nothing more than one of these airways. You know, I kind of got mixed feelings about this. I don't know when I'd ever use it. A lot of people recommend having it in their bag. You know, I had the space, so I figured, why not? I tested it on somebody. Somebody was brave enough to let me stick one of these in their nose. So we tested it, and I mean, it works. You know, if somebody's face gets smashed in and they're having a hard time breathing or something, maybe, you know, put it in there. I don't know, but we got one in here just in case. Who knows? Why not? Then we have the Johnson & Johnson. These are the Surgy pads. These things are hardcore at absorbing, and they're much better than really any other gauze that I've found for absorbing. These hold so much liquid you wouldn't believe it, and I mean, they're ultra compact. They're not much thicker than a gauze pad, but they are expensive. So, you know, these are one of the things that you try not to use if you don't have to. This is more of a blood stopper, you know, really big bleeding blood stopper. This will absorb a ton of liquid. I got 2 of these right here, so that's part of the airway kit. That's it for that pocket. Next we have the medicine pocket here. Standard I have a bag of just Tylenol and acetaminophen, and we keep that down there. So you have a choice. You can use them both in conjunction, for what I understand. And over-the-counter Tylenol works pretty well at relieving pain. So in the wilderness or wherever you are, or if you just have a headache somewhere, Tylenol is always a good thing to have. All right, in here, I'm not going to open this up, but what I have in this pocket here, there's loperamide, which is an antidiarrheal. It's a very nice pill. Definitely something you should have in your kit. Benadryl. We have Zantac for heartburn. We have some Alavert. We have some Gas X. We have Pepto-Bismol in there. We have some sleeping pills. And we have these IO-SAT pills. These are the ones for the nuclear disaster that blocks your thyroid out. Picked those up again on eBay, pretty cheap, in case there was a nuclear disaster. I'm not a big doom and gloom guy, but why not? Let's put them in the kit. In case something happens, you got nuke pills there too. Who knows, right? Alright, moving on down. Now this pocket I'm going to need to open up. Show you what's all in here. First we have the hydrocortisone. I like to keep the smaller little portable tabs so they're one-time use, so they don't leak. It's a big thing too. You don't want cream squirting all over your kit here when it gets rolled up. So I can keep smaller individual size tubes if you can. These are obvious hydrocortisone. Everybody knows what that is. We have a little pouch here just with some chapstick, some eye drops, and some Neosporin type triple antibiotic. Pretty standard stuff for a first aid kit. Just some Next Temp little temperature sticks. You just pop one of these guys out and you put it in your mouth for a couple minutes and it'll read your temperature. If you're sick, you don't have access to another thermometer, it will do wonders for you. I got a little splinter out here just as a backup to the needles if you need a splinter out. Excuse me. Yeah. Some burn gel. I've used that a lot in this kit. Alright, I've used that a lot in this kit. And you play around with a lot of weapons, and you're bound to get burned. It's probably one of the most common things for gun-related injuries is burns, and happens to the best of us. So burn gel is a must in the kit, and it's saved my life more than once. Eye wash. These are these portable little eye wash containers. You just pop the top off there and squirt it in your eye. No eye cup required. And these are pretty convenient, and have used one of them. I used to have 4 of them in here. I got to pick some more of these up, but those are convenient. Next we move down to another bleeding portion here. In here we have a quick clot. So let's pull this whole pouch out for you here. I mean, you can see if you need to get to it fast because everything's in bags, and you can pull it right out. If you were just to try to jam these in there, they're very difficult to get your hands around them. So it's important to put them in some kind of container where you can get a firm grip on it. These I don't have a second watertight seal on it. The first seal is good enough for me because it's in a watertight container anyway. So that's not getting ruined by water. We got the sturdy strips here. Just a tape stitch, pretty standard. Just some standard gauze here. This is just the individual, or these 4x4s. These are great, versatile Kendall, gauze. You can buy them in a giant pack for a couple $. Fold them up in these single-use pouches, and you'd be surprised at how many of these you use. And my theory for gauze packing is pack bigger gauze, because if you can get away with packing bigger gauze, you can always cut them down to whatever you need. If you start packing smaller gauze, if you need a bigger gauze, you don't have it. So pack the bigger ones if you can, and just cut them down if you need to. But if you waste this thing, if you only use a little bit of it, it's not a big deal because these cost like a couple cents. So these are lightweight, easy to compact in here. You can fit a ton of them. and not worry about it. Again, this is another bleeding pouch here. In here we have just 2 more of those Kendall 4x4 gauze patches, another quick clot, and a couple CPR face masks. In case you need to do that. Though the new way of thinking is, you don't do the breathing or the breaths anymore, but I'll still keep them in there. Next here we got the tool pouch here, tools and gauze. Obviously, the shears. Don't cheap out on the shears because they will break and they'll be trash. These cost, I don't know, maybe 10 bucks, and they're great. I've used them over and over again. They are extremely sturdy. These are the shears. The handles feel great in your hand. This will cut pretty much anything. They say they cut like pennies and all that. I'm not going to ruin the blades to find that out. But these come in handy a lot. The scissors is a very important tool. And we got some forceps. You don't know. I've never used these, but you never know if you're gonna need to hold some skin or something. If you gotta do some sutures or whatnot. Standard. I have some needle drivers. For the suture kits, and this is more than one use. You can use, I've used these on gloves. You use a suture kit, and you can use the silk sutures as actual, repair your gloves, or any clothing you need to do, like a sewing kit. These come in handy for driving that needle through leather. So I have that for the sutures and for multitasking. This was just a suture removal kit. It's got little scissors in there, tweezers, and I added a nail cutter. You need a nail cutter in your kit. In here we have a ton of gauze. We have some smaller Kendall ones here. It's a stack 3 deep, so I got 3 of those in there, 3, and there's 2 in each bag. I got another Surgy pad in there. I got this is a double pack of the 4x4s. This is a single pack of the 4x4s and another single pack of the 4x4s. So they're all sealed up, watertight. As you can see, that's a lot of absorbing power, and that's just one pocket. So you can really pack the gauze in there and not worry about it. Alright, moving on. As you can see, clearly labeled EpiPen. I have an EpiPen in here. I recommend having EpiPen. There are a lot of people with a lot of severe allergies that if they get bee stung or anything, if you have the opportunity to get an EpiPen to put it in there, I think it's a great thing. Now, I have one because I have a family member who has some allergies, so I'm able to get ones that are in date, and that's important with EpiPens. EpiPens are one of the few things that really start to go downhill when that expiration date comes along. So you want to replace that out as soon as possible. When it starts to be expired, because you don't want to be using expired EpiPens. They really lose their potency. Snare gloves, I have large, XL. I think there's 4 pairs. Yeah, 4 pairs in each bag here. So these are standard nitrile gloves. I don't keep latex in here because some people have some latex allergies, so might as well just go with the nitrile. They're stronger anyways. Got a scalpel in here. I recently used a scalpel for not anything medical related, but I normally keep 2 of them in here. So I actually have some more coming, so that's going to be replaced. I have an Oasis skin stapler here. This is actually a veterinarian tool. It's literally a stapler for your skin. And I'm not, like I said, I'm not a doctor. I'm not an EMT. So when if I do need to suture somebody, it's going to be much more likely I'm going to use a stapler than I am going to try to suture them, because all you do is press down and click and they're stapled. So if I need to use it, I got it. And you got a Sharpie, and you got one of these guys here. It'll let you make your own determinations. This is for if you get a hemothorax going on. And I'll let you do the research on that. I'm not going to go into medical procedures here, but I keep one in here. Worst case scenario, it has instructions on here also. you know, I don't plan on ever having to use this, but small enough to just throw it in the bag and forget about it. So it's in there. Up here, we got some nice hand wipes. These are with, let's see here. Well, these are the disinfecting hand wipes. They're not alcoholic, so, but they do sterilize your hands. And they're great to have. I mean, your hands get dirty wherever you are. So I keep a ton of these. You know, I got a giant box of them. I use these all the time. You know, even before you eat or something. It's nice to have these just for hygiene, you know. We got those. Standard alcohol pads. And then we have your Povidone Iodine swabs. I got quite a few of those in there. I got a ton of the alcohol pads because those things, as you know, are pretty cheap and they're pretty flimsy, so I got a ton of those packed away. Onto the tourniquet pouch. We have a standard cat tourniquet in its own pouch, so you can pull it out easily. I'm not going to try to cram other things in there. If you need it, it's in there for fast use. Pretty much self-explanatory. You know, I'm not going to go into the medical procedures, like I said. There's other videos for that. In here, we got some, you know, standard petroleum jelly. And then we have this, I'm not going to pull it out, but it's the oral rehydration salts. Pretty much like a Gatorade mix. It doesn't taste as good, but it provides a lot more than Gatorade does. And, you know, and it comes in a much bigger portion size that I can pack away. And that stuff, if you know, become dehydrated, gonna need that. Next pouch here, second last, we got some tape, you know, standard 3M tape. You know, it's the Durapore tape. I find that to be the best, you know, for whatever you're gonna use. Lets your skin breathe, you know. There's some of that waterproof tape I'm not a big fan of because it doesn't seem to really stick that well. This stuff can really stick good, even if you're sweating, and yeah, works pretty well. And we got some of that Core Bond tape, which is pretty much that elastic tape that you can use, you know, to go around splints or really go around anything. You know, if you're going to put that around a gauze pad or something to hold it in place. You know, I just have a little bit in there because I have a lot of other tools that can be used for that as well. And that's a lot of thing about this kit, is that a lot of these tools in here are multitaskers. I like to keep things that do a lot more than one job. So if something does happen and you use something, I mean, there's been times where I've used, you know, entire pouches of this have been gone, and you know, something else might happen, and that's why you have backup for things, and that's why you have things that do multiple jobs. So in this kit, it's all about redundancy and about trying to handle as many jobs as you can with one item. And we have a standard boo-boo kit, you know, Band-Aids. There's a lot of Band-Aids in there. I got some moleskin in there, all different sizes of Band-Aids, big, small, you know, little dot Band-Aids. Pretty much cover any little boo-boo you got. And if not, you can always make yourself a Band-Aid with some gauze and some tape and whatnot. Got my suture kits. I got quite a few of them in there, all different size, threads and all that. You know, I've practiced this on some stuff. I've never performed sutures on somebody. Could I do it? Sure. You know, if I had to. You know, it's a last case scenario type thing. But got them. Like I said, you can sew with them too on your gloves or gear that break down. And you'd be surprised. It works pretty well. You know, a little prophylactic here. Not going to explain that. And just another 2-pack of the small gauze. And you know, obviously the small gauze, just again, it's very cheap, effective. You can make Band-Aids out of them if you need to, or you can clean wounds. They're in here for cleaning wounds quick, so you can just go to one pouch. I try to have every pouch in here specialized to what the problem is. Sometimes you can't, obviously, where you need to cram stuff in, but for the most part, it's pretty well organized. And you know, I've been building this kit for a long time. I mean, you know, whether it comes down to camping, shooting, you know, whatever the problem may be, you know, this would even be very useful, like an active shooter situation. You come there after. You have plenty of, blood stopping supplies here that you could really do some good. And obviously it's not a combat pack, like I said. It's not a pharmacy. It's not a combat pack. I'm not a pharmacist, so I don't have, prescription drugs that I keep in here to cure everything. I don't keep antibiotics because this philosophy for this bag is the world order still exists. There's going to be follow-up medical care. This is to patch you up and to get you to that follow-up medical care. This is not to be your doctor's kit. This is to provide that aid that you need to survive and then go get help afterwards to fully repair you and fully medicate you. And it's worked out for everything I've needed. I keep adding things and, here and there. It's pretty much at its fullest point now, so I don't think I can really put out anything else in here. But thanks for watching, guys. I hope that really helps somebody of you guys out there thinking about making a medical kit. Have a good one.